Over at APSN, we provide special education training to individuals with intellectual disability, specifically mild intellectual disability, IQ range 50 to 70.
Children's Cancer Foundation actually is dedicated to improving the quality of lives of children diagnosed with cancer and their families, and also children impacted by cancer.
The association was set up to support and provide families, professionals, as well as the general public about the genetic condition.
Causes for Animals Singapore, we focus a lot on street work, so we care for the community cats and street dogs in Singapore.
Playeum is an IPC charity that works with children and their adults. We use open-ended play and the arts in developing 21st century skills like creativity, critical thinking, communication, collaboration, confidence, resilience, all these amazing skills that are actually needed in this world right now.
Essentially, Care Corner has 5 key pillars of services. We call that the 5 pillars of services of work in Care Corner. They are children, youth, families, mental health and counselling services, as well as senior services.
So pandemic happened, the circuit breaker happened. It creates a lot of confusion, a lot of adaptation for our individuals with intellectual disability.
So of course, everything had to go online, especially when our children are lower immunity and many of them could not be vaccinated. So we basically moved a lot of our services online.
When they had to embark on home-based learning itself, there were certain challenges such as to be able to operate the computer in front of them and to actually lengthen their attention span in front of the screen itself.
Times got tougher, and so of course the funds that came in were also a lot lesser. So we definitely faced a problem when it came to paying the medical bills of the street dogs and the shelter animals and community cats.
As a charity, we were a centre-based model. The centre was open free for children from marginalised communities and those with varying disabilities. But we ran off the revenue of people that came to visit our centre that paid to come from regular kids. And we thought, what are we going to do? So we knew also that it was tough for us because we relied on that revenue.
When we serve seniors, we have to be very sensitive to their mental health even during this time.
The fund came in very timely, so it helps the entire centre as a whole to better support our population. So we are able to come up with contingency programs, contingency support to better help our population during this difficult time.
We actually used it a lot to do up our CCF and Have Our Hope website, really looking at new payment gateways and really making it easier, much easier for our donors and supporters and stakeholders for an easier interface to donate and to actually engage with us and our beneficiaries.
DSA's programs are heavily subsidized, and we need to raise sufficient funds each year to support these programs. We are indebted to the community and the government for coming together through the Bicentennial Community Fund to improve the outcomes of persons with Down syndrome and help our caregivers and families in their caregiving journey.
So a lot of the funds from BCF went to our programs that we ran for the children for free during the COVID period. The Kampong Conversations, the Playeum at Home programs. We also ran other programs for children in Sunbeam Place. We also ran programs, for example, with South Central Community Family Service Centre, where we worked with different children where they were going to PSLE and they needed to build their strengths, their confidence in going into the next year. These were children that found the challenges in the education system. And we used play and the arts and also for them to set goals for the next year that they were facing.
So the BCF fund, I think one of the biggest advantages is that they allow us to deploy the funds in the way that the charity itself feel that that deems fit and suitable to use the fund in the most appropriate manner.
So most of the funds actually went towards covering medical care for street animals, mainly community cats and street dogs. So a lot of the fund was used to cover sterilisation as well as medical care of the animals in need.
Because of this funding, we are able to hold our programs and deliver our services in a much more creative and sustainable manner, especially in pandemic times. Thank you so much.
This has impacted lives than in more ways than we can imagine. Truly, thank you.
On behalf of the Down Syndrome Association of Singapore, we are indebted for the Bicentennial Community Fund. It has not only improved the outcomes of individuals with Down syndrome, but it has also helped us to provide the care and love for their caregivers and family members in their journey of caregiving of persons with Down syndrome. Thank you.
Thank you for helping us support street dogs and community cats in Singapore.
It has helped us journey thus far, and not only that, it's helping us to carry on this journey to empower and give voice, agency, 21st century skills to the children of our future. Thank you.
It has really helped us to deploy the funds in the most best way that we can so that we can serve our service user. Our vision in Care Corner is to bring care to every corner in Singapore. This is what we are doing in Care Corner so that we can serve more and more of our beneficiaries.